We cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
The Director General of the World Health Organization urges all countries to test for the coronavirus as the number of cases rises globally. Hello, I'm Anand Naidu, and this is The Heat. With more than 190,000 cases worldwide, governments are urging residents to remain at home, shuttering schools and businesses to stop the spread of the coronavirus. In Italy, the death toll is now over 2,100 people, with 329 deaths in just one day. Across Europe, France, Spain and Germany are also taking measures to keep residents at home. And here in the United States, US President Trump urged Americans to work from home for the next 14 days and promised financial help for workers. For more, we turn now to CGTN's White House correspondent, Nathan King. And Nathan, what action is the Trump administration taking?
Well, Anand, there's still a huge shortage of tests. There are worries about everything from rubber gloves to intensive care units. But you can tell the federal government is starting to think, and one would hope act big. The big question now is whether it's as big as the coronavirus cases and the wave that is coming. US President Donald Trump, who's essentially delegated a lot of the communication over the coronavirus crisis, stood here in the briefing room for an hour and a half answering questions, really trying to sort of show that he is in command. And there was a mixture of realism, which we saw for really the first time on Monday here, but also still this optimism that he's had from the start that someday soon, he says, we'll see the back of this. Let's take a listen.
We're giving relief to affected industries and small businesses, and we're ensuring that we emerge from this challenge with the prosperous and growing economy, because that's what's going to happen. It's going to pop. One day we'll be standing possibly up here. We'll say, well, we won. And we're going to say that. Sure as you're sitting there, we're going to say that.
July or August, he said the crisis could last to, and that was yesterday. And I can tell you that his health officials are perhaps less optimistic even than that. And if you look at the economic packages that are being prepared here in the United States, and you can tell that when it comes to the money, people think this is going to have a huge impact. You remember the financial crisis here, I do as well. Well, the stimulus package being prepared by the White House and going to be accepted on Capitol Hill could reach $1 trillion. That's ahead of what was in 2008, 2009. And what it's really going to target is both businesses that have been hit so hard and so quickly by this, but also, for the first time in living memory, Americans are essentially going to be sent a check to spend right away. Steve Mnuchin, the Treasury Secretary, says he wants this to happen now.
We're looking at sending checks to Americans immediately. And what we've heard from hardworking Americans, many companies have now shut down, whether it's bars or restaurants. Americans need cash now, and the president wants to get cash now. And I mean now, in the next 2 weeks.
This all comes, of course, as the 100th death came here in the United States. Also a landmark. Now all 50 states and the District of Columbia, Washington, D.C., all have cases of coronavirus. But as we know, as testing ramps up and this wave comes, it's going to be the tip of the iceberg. Back to you.
Thanks, Nathan. That's Nathan King reporting from the White House. Well, for more now on the global impact of the coronavirus, let's bring in our panel. Joining us from Portland, Oregon is Ken Stedman. He's a virologist and professor of biology at Portland State University. Also with us from Seattle, Washington is Dr. Gregory Jantz. He's a mental health expert and best-selling author. His latest book is called Healing Depression for Life. Laura Silvia Battaglia is a journalist based in Milan, Italy, and Einar Tangen is a political and economic affairs commentator based in Beijing. Thank you to all of you for being with us. Laura, let me start with you. Of course, this virus has spread across Europe, but Italy is facing the biggest crisis right now, particularly northern Italy, where you are right now. The death toll, as we reported, more than 2,100. What is day-to-day life like in Milan right now?
Milan today is like a Gotham City. People are locked in their houses and everything is shut down. Just a huge supermarkets to hang out a little bit together and talk a bit. And the habits of people changed a lot. Totally changed because it's a city very crowded, like London or in somehow New York, and people they used to go around every day. There are a lot of debates actually in the city because people they feel really compressed at home. So many are asking to go out just to have a run or to walk a little bit, but it's not possible. The government said staying home. If you don't stay home, you will be fined. So there are measures more strict for anyone who goes out, and people can go out only to buy food or just to go to the doctor or to the pharmacy. So the situation is very tense, honestly, and people are very worried. The Bergamo city is a city close to Milan. There are a lot of people that have the disease, and in one day only 500 people, just 500 people died, and there are families that they know, relatives and other friends that are already dead. So situation is really very difficult.
So Laura, you are right there in the middle of it. What kind of precautions are you taking?
The precautions are staying home first, go out only if needed, like, buying food and going to the pharmacy, and trying to protect yourself with gloves and with mask, and try to, if perhaps you were in contact with somebody who was positive, respect strictly the quarantine, staying home for 15 days. And same, try to don't go around for any other reason, and stay calm and stay well.
Right, and Laura, and as you pointed out, I mean, these are drastic measures that are being taken. How are they being enforced, or are just people just observing the fact that there should be no gatherings, no travel, that they've got to stay indoors all the time?
Yeah, travels are now quite banned from the north to the south, especially because many people went from the north to the south. They literally assaulted trains to go to the south. The north is plenty of workers and students who are coming from the south. So this is a new measure to prevent the spreading of the disease in the south, where the healthcare is not good at all. But actually, there are announced new measures because the next 2 weeks will be maybe the top of the spread. So the authorities are very afraid, and they're afraid also because there's no space anymore in the intensive care in the north of Italy. So one of the solutions could be transform an area to a field hospital right now in a couple of weeks.
Yeah, we have seen those reports about the hospitals in northern Italy being overwhelmed. Let's go to Gregory Jantz. Gregory, you are in Seattle in Washington State, which has seen the highest number of infections here in the United States. What is the situation there? Is the rate going up?
One of the things that we're noticing is it depends where you are. I'm in North Seattle, and you would think today everything seems quiet but normal. But if I go a few miles away and line up at certain stores, you would see the panic, and you see people here kind of running, if you will, in herds. Panic breeds panic, and so what we're seeing is certain segments of concern. There are other areas in our surrounding communities that I believe there's anxiety, yes, but we don't see the same level of panic.
What additional measures has Governor Jay Inslee taken there, Gregory?
Well, we have the measures of no gatherings over 50, and certain requirements need to be in place around those 50. Right. We also are following, and here at the Center of Place of Hope where I'm at, the 10-person rule, no greater gatherings in 10s. We know that we have our restaurants, our bars, or everything's down to takeout or delivery options only. So that's kind of where we are now.
Ken Stedman, when we look at the enormity of the challenges that the United States is facing right now, drastic measures being taken across the country, but it doesn't seem that everybody is on board. This is what the director of the National Institutes of Health, Dr. Anthony Fauci, said in Washington today. Let's watch.
don't get the attitude, well, I'm young, I'm invulnerable. You are, well, in some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating.
So Ken, how do we get everyone to take this seriously?
So I think that's a very good point. I think Tony Fauci does a wonderful job of explaining this. But one thing that has been done, and I think has been done very well, is really closing universities. And I think people are closing universities, closing schools, which we've done in Oregon. And that seems to have really been the point where people are starting to think about this really seriously. And so my hope is that that process, again, closing the schools, closing the universities, it's been a really big change for myself at my university. We've completely gone to remote teaching. And so I'm hoping that that's going to be the real kicker, if you say, which is going to get that message to some of the younger people.
I want to go back to Laura. Laura, I know you have to leave in a few minutes. One more question I have, and that is, Italy is under lockdown right now, travel restricted, businesses affected. What kind of help is there from the state for people who are not working right now?
Yeah, the government signed with the parliament a decree yesterday of 113 articles, and there will be an injection, immediate injection of 20 billions of euros in all system, and a total injection of 350 billions during the year. Basically, the first move is help for the families. Will be an extra check of 1,500 euros per month for families that have problems, and all companies and small businesses will be helped delaying taxes and bills and delaying also the VAT for young professionals.
Okay, Laura, thank you so much for being with us. Thanks for your time, and our best wishes to you. Let's move on now to Einar Tangen, who is in Beijing. You know, Einar, we look across the globe and there's a very bleak picture, but there is one small ray of light, and that comes from China. According to a Xinhua report, the first batch of medical assistance teams have already started to leave Hubei province. This is where the virus started, which is where the city of Wuhan is situated. We're hearing from officials now in China that the virus outbreak has been, quote unquote, subdued. President Xi Jinping has also been talking about this. He says, quote, it has been basically curbed. What can you tell us about this?
Well, China has had, in effect, what Italy is going through right now for the last 2 months. I've been undergoing that. I mean, very, very stringent restrictions. And I don't mean to my personal liberty. It's just these are things that are necessary to curb this virus. In terms of has it been licked? Yes, it seems so, but you have to be always very cautious because right now things are getting back to normal. Businesses are starting up. There are more people on the streets, although in Beijing, most of the Chinese restaurants are closed. I think in the next few days they'll be opening, but they have still stringent requirements. You cannot sit directly across from anybody. There's no group gatherings. So, you know, it's one of those things where they continue to be very vigilant, and it's one of the lessons that has to be learned. I'm surprised that the U.S. is taking this so cavalierly. In essence, it's not enough to say it's okay for 10 people to get together. That means 10 people could pass it on, and you can start figuring out the geometry of progression that would have. This is an extremely infectious virus, and it's something that has to be watched very carefully.
I know one point about travel in China. Have the travel restrictions been lifted?
Yes and no. I mean, if you're going from certain cities to other cities, you're going to be quarantined for a period of time. I cannot get down to Shanghai unless I'm willing to do 14 days, perhaps in quarantine down there, and then 14 days when I come back to Beijing. It's expected that some of that will be lifted, but if you're coming in to China from outside of China, it doesn't matter if you're Chinese or foreign, you will spend 14 days in isolation. Most people are doing this at home, unless you're showing acute symptoms, in which case you will go to a facility where they can isolate you and also make sure that you get the care that you need.
Gregory, looking at the whole idea of quarantine, going into self-quarantine or going into quarantine with your family, I mean, that's one thing, and that already poses a challenge to people, especially people who live alone and are going to be alone. But looking at some of the other responses, we've seen panic buying in supermarkets, growing fears among older people especially, whom we understand are the most vulnerable to this virus. I mean, what kind of mental toll is this taking on people?
Well, we know that anxiety gets so high that some people, it kind of moves over to that edge of despair. When we get to that place, people start to look for ways to cope. Well, we're going to see a lot of food consumption, and we're seeing, I believe, increase in alcohol consumption because we're looking for a way to mood elevate. We need to change how we feel, and people can only tolerate anxiety so long. I think it's important to determine social isolation versus social distancing. If we socially isolate too long, that anxiety and depression goes up. And so we need to look at a way to practice good self-care despite the confinement versus being so self-absorbed. We kind of lose our rational mind when things get so intense.
Ken Stedman, one of the biggest shortcomings we've seen here in the United States is the shortage of test kits. And we did hear right at the beginning of the show, the WHO, the World Health Organization chief, tell us we cannot stop this pandemic if we don't know who is infected. We need to test, test, test. We also had the former head of the CDC, Dr. Tom Frieden, say that the infection rate actually in Seattle could have been much lower if test kits were available. Do we know what's happening right now insofar as test kits are concerned? Are they getting out throughout the country? We heard just about a week ago that there was something like 1 million kits that were going to be available.
So the answer to that question is I don't know. I'm not specifically involved in this process, but I am actually working together with our local medical school. I may actually be physically going into the lab and starting to do some testing myself just to get more capacity online. I think that things are getting much better, but it's really hard to tell from where we sit.
And what is the testing process right now? I mean, is it a streamlined process? Because we heard that there was a risk of people going, for instance, into emergency rooms, because if they are positive, if they have the coronavirus, they could spread that to people who've come to the emergency room for something else. And then we heard people talking about testing with people in cars. So do we know if that process has been streamlined?
This seems to have happened, as many things in the United States, in a very state-dependent way and very much a local way. As far as I know, I think in New York State, they actually are doing some drive-up or drive-through testing. That hasn't been implemented in Oregon, to my knowledge, yet, and Greg may know more about this in Seattle, but one of the things that is hopefully being impressed upon people is if you have symptoms, don't go to the emergency room, don't go to your hospital, call your doctor, call your medical provider. And so that has been at least the message which I'm hearing, and hopefully that's a message which is coming across, because exactly, you're right. If you go to the ER, and this is what I tell people, is if you go to the ER, even if you don't have the disease, it's quite likely that someone else there will. And so you're actually putting yourself in a worse position if you go to the ER. So call ahead and then figure out what the best way, if you do have the right kind of symptoms, then hopefully you will be able to get a test. And that's something that the medical professionals will know and should hopefully be able to transmit.
Einar Tangen, we were talking earlier on about some of the restrictions that are still in place in China, despite the fact it looks like China may have turned the corner. What about a city like Beijing, the capital, with its huge population? Do you see a lot of restrictions still in place there?
Yes, I mean, I'm still monitored when I come in and out of my compound. I cannot have guests. And this is uniform, but there's no sense of resentment about this, quite the opposite. I think it has improved confidence that the government is doing what's necessary to control this. And as people see day after day the number of cases going down, I think there was only one new case yesterday, and there were 20 cases, but fortunately those were people coming into China. So there's still a sense of confidence, but there's also a growing sense of unease. There's some resentment towards this idea that this has been named a Chinese virus. A lot of people think it's hypocritical, given the fact that Europeans brought to America everything from typhoid to cholera to the plague, famously on Staten Island, which was traded for a bunch of blankets that were laced were disease-ridden. This type of thing doesn't sit well, as do the attacks on Asians around the world. Not Chinese. This is just, from Hmong to Japanese to whatever. If you look Asian, you're being discriminated against. So, there's this feeling that things are okay at home, but overseas, things are deteriorating.
Right, that's an important point you bring up there, Anna. In fact, we have seen these nasty side effects, these ugly side effects of this coronavirus crisis. A lot of xenophobia coming out of the United States. President Trump, as you pointed out, referred to this as a Chinese virus. We even had a reporter at a U.S. network who said that administration officials here at the White House referred to the virus in terms that were meant to disparage China. And this coming at a time when, I guess, all countries of the world should be working together.
Absolutely. This is the sad part of it. There seems to be an attempt to link this tragedy and this worldwide emergency to economic and political agendas that the Trump administration has trying to push. And that's just plain wrong. There are different avenues and places to have these kinds of competitions. This is not one. This is personal tragedy. A lot of people have already died. More will probably die. It's not the time or the place to be doing this. And as I said, there's this real unease, the sense of hypocrisy. Why is this being done before? Most Asians were lauded as people who are adding to the economy. Now they're viewed as pariahs in their own home countries. And I mean, because they may be Asian by ethnicity, but they're Americans, just like I am.
Ken Stedman, looking at the medical challenges here in the United States, if there is a surge in the United States, there's been a lot of questions being asked over the availability of ventilators, respirators, protective gear for health workers. Let's listen to what President Trump had to say about that. Let's watch.
We've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment, but compared to what we're talking about here, this has never been done before. And yesterday I gave the governors the right to go order directly if they want, if they feel they can do it faster than going through the federal government.
So the question, Ken, is the country prepared for this if there is a surge?
So unfortunately, I don't know, and we will find out, and that's kind of the least satisfying kind of answer, is that we'll find out when it actually happens. I hope that we are prepared. I really don't know if we are.
Okay, let me go to Gregory. Gregory, people are coming under all kinds of pressure, as you talked to us about that just a moment ago, as this virus is spreading. And we have people who may have the virus who don't show any symptoms, so we don't know. And we're also seeing that information is very scarce. We're not even sure which groups are most vulnerable. Is it the over 60 group? Is it the over 80 group? What about those with underlying medical conditions? How are they going to be affected? How does that affect people when we don't have all this information at hand?
Well, one of the things that we're seeing, those individuals that have post-traumatic stress disorder, we're seeing this is a tipping point. This is a trigger point for a lot of increased anxiety, panic attacks. We're finding that those who struggle with something called obsessive compulsive disorder, OCD, that you can imagine the invisible virus, the invisible germs, so to speak, are pushing these individuals just, over the edge. And so I believe we're going to see some suicidal ideation, a point that is just of saturation emotionally, where people are going to feel like it's too much. I can't handle this. And so that's going to be particularly true of those who perhaps have struggled with some mental health issues that have been significant. This is like the tipping point.
And we haven't really thought about that kind of help that people are going to be needing as well. You know, psychological therapy, psychiatric therapy in some instances.
Absolutely. We're going to see an increase likely of addiction behavior. We're going to find that individuals who have been coping maybe secretly, misusing prescription drugs, turning to drugs, probably even some digital addiction that's creating a problem, probably a lot of alcohol consumption. So we're going to see another layer of addiction on top of those emotional issues.
And Gregory, one other question I had, and that is something that the President said, I think it was yesterday, here at his daily news conference, in which he was talking about a timeline that we could see the worst of this through July or August. What do you make of that?
Well, July or August, of course, it's summertime. I'm not so sure that that's that helpful right now, because for some, they're going, I can't make it that long. I can't make it that long. There's the financial stress for many. There's, will I be able to get food, supplies? So a time frame, even though you go, okay, that's out there somewhere, but we don't know what's true. We don't know how long. And I think that adds to the uncertainty. What if July or August comes and it's still very significant? What will that do?
Okay, Einar Tangen, I've just got about 40 seconds left. How do you see this situation unfold in China in the days and weeks ahead?
Well, there continue to be a cautious approach. The Chinese government monitors the information. They have a fairly transparent system. People can see what's there. People are coming out cautiously. But I just wanted to add something to the mental health issue. You know, in America, things are going towards the edges. It's surreal. You have people lining up to buy guns on one side, and then you have crowded beaches in South Florida as young people are determined to enjoy their spring break. So it's not something simple, and there are going to be repercussions.
And that's where we have to leave it. Thanks to all of you for being with us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.